Vitamin D, also called as the sunshine vitamin, and the active form of vitamin D is 1,25 dihydroxy vitamin D. Coming to physiology of the calcium metabolism. So PTH, also called as parathormone, is going to have an osteoclastic activity, and which is going to cause increase in the calcium present in the serum, and also it is going to increase the phosphate excretion. But if this phosphate excretion goes on increasing, then there will be phosphate deficiency also, which can also give rise to bone defects, because phosphates are required for endochondral calcification. Alright, so the most important thing you have to remember is vitamin D is going to cause nutritional rickets, and this can be either due to decreased intake of vitamin D or due to decreased sun exposure, because of which the active form of vitamin D is not going to be produced, and then there can be due to decreased absorption from the intestines, or it can be due to certain drugs like anti-TB drugs or anticonvulsants. So what is the thing that is going to happen? There will be certainly very much low amounts of calcium in the bone. So coming to some of the clinical features in case of rickets. These are the 10 important clinical features in rickets. The first is delayed closure of fontanelles present. There can be white sutures between of the skull, and there can be frontal bursting. So in the head itself, there are three important clinical features. Then there can be what is called as craniotasis, which is nothing but parchment-like skull is going to be present. And then in the dental region, there can be dental hypoplasia. In the chest region, there can be rachitic rosary. There can be presence of pectus carinatum. There can be Harrison circus. In the chest region, there are three clinical features. And then finally, in the wrist region and ankle region, there will be swelling will be present. And in the knee region, there will be presence of bowing of legs and knock knees can be present. So how do you diagnose this condition? By radiologically you can diagnose, or through biochemical way. On radiology, you can see there will be presence of fraying of metaphyseal margin and splaying out of the cartilages. And biochemically, there can be presence of less than 10 nanograms per ml of vitamin D will be present, or OH 25 OH D will be present. Remember the normal values, it is 20 to 60 nanogram per ml, and it is going to have a toxic effect, that is hypervitaminosis. D can occur if more than 90 nanogram per ml is present. So how do you treat it? It is by SLOS therapy, which is vitamin D. In both of those should be given 6,000 international units daily, and prevention is by adequate sun exposure and